Okay, hi guys. We are live. This is Councilwoman Tameika Devine, and thank you for joining me for community conversation. This is something that we started maybe about 3 weeks ago. Since we're all home, but we all have lots of questions going on, I wanted to bring you some really good content on conversations that are things that people are talking about, not necessarily on their kitchen tables anymore, but are on Zoom meetings or on the telephone or just hearing about it in the news. And I think that we have to have these real conversations in order to really make change in our community. And I'm super excited. I'm going to share this broadcast for those of you who are watching and you want other people to hear, then you need to share as well. But I'm going to share this broadcast so that everybody can see. But I'm super excited today because I have with me a really dear friend that I've known, and I was trying to think about it last night, Anton, when I was going over. I've known Anton for probably 25 years now, and
Yep.
we'll talk a little bit about kind of back when what he was doing and what I was doing when we first met. But we've always been really engaged in the community. But when there was a lot of conversation around what's going on with the COVID-19, racial health disparities. I wanted to have this conversation, and I couldn't think about anybody I wanted to better have this conversation with than Anton Gunn because he has so much experience. And I think that a lot of folks have seen him. He's an amazing, dynamic speaker. He speaks a lot on leadership, socially conscious leadership. So we're going to talk a little bit about that as well. But most people don't realize that his health, his experience is in public health. And so for many, many years, he's been working on the front lines. And so this is why I felt like he was the best person to have this conversation with. So for those of you, I'm not going to read everything about him, but you got to hear a little bit about his accolades. So, Anton is a former senior advisor to former President Barack Obama. Actually, people know that I endorsed Barack Obama, and I'll tell you that I was impressed with Barack and wanted to endorse him, but really the way I met Barack was through Anton Gunn and Rick Wade. And Anton and Rick both called me and said, we've got this dynamic young guy that is running for president, and we want you to meet him. And he was coming to South Carolina for the Jefferson Jackson dinner, is what it was called back then. And Anton was like, we're putting people at his table. Do you want to, can we invite you to sit at the table? And I was like, sure. And it was funny because y'all know this here in South Carolina, everybody was kind of on the Clinton bandwagon, and people were like all over Hillary Clinton. And we were sitting with Barack. Jamie and I were sitting with Barack and Anton and Ann Parks from the upstate. And we had just the most amazing conversation. And I left that and said, okay, I know if Anton and Rick say you're a good person, then that's where I need to be. But after talking to him, I was all in and supporting Barack. And so Anton was led up Barack's campaign here in South Carolina. And we all know the end to that. Barack won South Carolina, and South Carolina made him president of the United States. And so Anton has a lot of history. He's a former South Carolina House representative. He retired from there to go work in the Obama administration and Health and Human Services. And so you were there at the very beginning of Obamacare, not just getting it passed, but the implementation of it. And then once he left the Obama administration, he came back. I say home because you've actually been in South Carolina longer than you're in Virginia, but he is from Virginia,
Correct.
but South Carolina is home now. And so you came back to South Carolina, and you and your beautiful wife, Tiffany, who went to high school with me, and your beautiful daughter, Ashley, are in Charleston, and you're speaking all over nationally and internationally, but you're still working to help people in healthcare. So for that brief introduction, wanted to dive in. For those of you who are watching, and I see I got a couple comments to make sure. Lolita says hello. Hey, Lolita. For those of you who might have some have some questions for Anton, please let me know. Please type them in the chat box, and he'll answer your questions. But first of all, just welcome and thank you, because I know you're super busy. Most people are working from home. But with you in healthcare, this is not just work. You're doing this nonstop. So thank you for taking the time out to have this conversation. So with
Well, I'm definitely happy to be with you. And I would say we have known each other for about 25 years, and it's been always great to not only get to know good people, but to work with people who are mission aligned on everything that they do. And I think that's one of the things that both Rick and I saw is that your commitment to community, your commitment to people, your commitment to informing them is the type of person that Barack needed around him and that we all need around us as people who keep us and make us better because of what they share and because of what they contribute. So definitely thank you for your leadership. I was looking up something as well, so you ain't the only one been doing research. I did not realize that you've been in public service as long as you've been in public service, and that that's a lifetime for some people. And the fact that you're still so young shows me that there's so much more left for you to do in our community and in the state of South Carolina and beyond. And I'm just glad to work with you, glad to watch you grow and blossom, and know you and Jamie and the family, and that we have so many parallel tracks in our lives, even back to your alma mater at Hampton University, knowing that my great great uncle was in the class of 1883 at Hampton. I don't know if you even knew that,
no.
but I'm a legacy baby, Virginia to Hampton, and so yeah, so we got lots of stuff in common, lots of great work, and that's why I'm always happy to do this for good people who are going to help us get the right messages out there so people can make better decisions in their lives for themselves and their families, and that we all can be the kind of leaders that we want and that we deserve.
Well, thank you so much. And for leadership, you were definitely up there. And so we're going to talk a little bit about your book too at the end. But for those of you who are leaders, and everybody who's watching this is a leader, you need to get his book because it's an amazing book that talks about leadership traits and principles, and we'll talk about that. But let's jump into our conversation. And so, the first thing I wanted to ask you about, kind of going, the reason I wanted to have this conversation is there's been a lot of conversation about, of course, right now we are all still, well, kind of still under stay-at-home orders. Our state is a little bit tipping its foot in the pool there, but most of us are still under stay-at-home orders. And so since we've been under stay-at-home orders, we're dealing with COVID-19. And when people first started talking about COVID-19 and you'd hear the epidemiologists talk about the numbers, and they would say, most people can kind of come out of it, unless you have underlying health conditions. And they would just say underlying health conditions. And, and then when every time they say the death, they'll say, so-and-so, a middle-aged person with underlying health conditions, or a senior with underlying health conditions, and really wouldn't talk about underlying health conditions until the fact that people started asking more questions. And then for me, people in my community, until they started knowing people who actually passed away, and had COVID-19, and they're like, wait a minute, I just saw them, they're healthy. People realize underlying health conditions are high blood pressure, diabetes, which, most in our community we call sugar, and obesity, and things that really a lot of communities of color experience these as health conditions that we don't really consider them as health conditions that will elevate us to, to die, because we get a certain disease. And so can you talk a little bit just about, from your experience, for your long history in working in public health, about health conditions, and why do we see them primarily so much more prevalent in communities of color, and maybe historically, what is the reason for that?
Yeah. So yes, this whole COVID crisis has really kind of put at the forefront the challenge around health disparities and what people are dealing with and have been dealing with for a long time. So in order to unpack this, and we probably could spend a half a day talking about what I'm about to share, but I want to unpack this a little bit to say that in the United States of America, health disparities have been with us for a very long time. There's a famous quote from Dr. Martin Luther King Jr. in 1966, where he says, "Of all forms of injustice, the inequality in healthcare is the most shocking and inhumane. That Dr. King saw a whole lot in his life. He saw separate water fountains. He saw people riding in the back of the bus, that you couldn't eat at restaurants, you couldn't stay in hotels. Police officers would let dogs loose on people. You had lynching and raping. You had all kinds of bad things happening to people. And Dr. King said, of all forms of injustice that he's seen in his life, the most shocking and inhumane is what happens in healthcare. So that lets you know that this has been with us a long time before even Dr. King. And what this really means is, if you are a person of color in the United States of America, particularly African American, but also inclusive of people who are of Hispanic and Latino descent, you have not enjoyed the same access to health insurance coverage, to doctors that speak your language or understand your culture, to hospitals. There used to be a time in America, just going back to the hospital piece, there used to be a time when you were Black, you were brought to the hospital, they put all of the Black patients on the same floor, same unit. So that you could be delivering in this corner, in the other corner, somebody suffering from a stroke. In the third quarter, this is somebody who broke their leg. In the fourth quarter, this is somebody suffering from sickle cell anemia. 4 different conditions, should not be in the same space or the same room, but because of segregation and racism, construct that we had around our society during those days, Black people were all cobbled together to get care. And you didn't have the best doctors, you didn't have the right clinicians. You may have just had a trainee who was 2 years in med school delivering care to you. So these inequalities have been with us for generations. Also, the lack of access to good, clean, safe drinking water, or a neighborhood that's safe to walk around in, or having access to fresh fruits and vegetables, food deserts. All of these things didn't just start in 2020 or 2010 or 2000 or 1990. These things have been with us for a very long time. And because of that, you'll see people who have different outcomes, that you'll see a higher prevalence of diabetes or high blood pressure, or you'll see more prevalence of being prone to violence, more mental and behavioral health issues that we would never get addressed in our community. So these disparities have been with us for a long time. What happened with COVID-19 is that COVID-19 showed us there is a virus that doesn't know your gender, doesn't know your zip code, doesn't care about any of those things. It will affect anybody. But this virus makes it harder for you to recover if you have any underlying issues. I can just think about how cigarettes were marketed to the African American community heavily for 30 or 40 years. My father, who was a smoker and passed away in 2016 from the complications around lung cancer, he started smoking when he was 16 before he joined the Navy. And the cool cigarette commercials were the ones that were marketed to him, and that was his brand. And so when you smoke a lot, you have diminished lung capacity. So now we have an upper respiratory virus that attacks your lungs and makes it hard for you to breathe. So imagine if you've been a smoker for 10 years or 20 years or 30 years, and now you really do need your lungs to breathe, to jet off an infection. Well, it gets more and more difficult to be able to do that. And your ability to recover is about your immune system. Well, your immune system is weakened when you have diabetes and when you have other autoimmune diseases like sickle cell anemia, like lupus, and all of these other conditions that affect our community. Your immune system is weakened. And when your immune system is weakened, it's hard for you to fight off the virus. And so this is what's brought these health disparities right to the forefront in the middle of the COVID-19 crisis.
Wow. That is, and I think that way you broke that down is so good, because people don't think about these are systemic things that, are part of where we've been, and we have not addressed it. And so let me ask you this. So I talked about the fact that and Lolita asked a question, and that was pretty much the same question. She just asked, are there differences in symptoms? So are there any differences in symptoms between African Americans and communities of
Yeah.
color, white, and majority population?
Yeah, so literally, I was just looking at some data about this, and what I want everybody to understand is this novel coronavirus, COVID-19, is it when we say novel, that means it's new. That means we haven't seen it before. So because we haven't seen it before and it's new, that means we don't know everything about it. There's very little predictability in the virus. And so here's what I mean predictability. You probably heard on the news from CDC and other places around the number one symptom is a fever. Well, that's what they said the first 2 or 3 weeks, but now they've stopped saying fever because we're actually seeing that some 50%, sometimes 60% of patients never ever get a fever, but they've tested positive for the coronavirus. You've also heard people talk about a cough. Well, the cough has been the most consistent one, but everybody still doesn't have a cough and they're testing positive for the coronavirus. But then there are other symptoms around a sore throat. There's symptoms around diarrhea or what they call GI issues where you have diarrhea and maybe a little bit of vomiting. What I'm saying to you is the symptoms are across the board and there's no uniqueness around them for us to say that if you have these three symptoms, then you do have coronavirus. Or if you have these three symptoms, you can just assume that it's allergies and you don't have coronavirus. There's no definitive nature of these symptoms. Both of them usually are connected together. And that's why it's so important for everyone. If you have any kind of symptom, even if you have spring allergies and you think, oh, my allergies act up like this every year, but this cough is not going away. I want you to do whatever you can to talk to your provider or your clinician to find out whether you need to get tested. Everybody doesn't need to at this point because we don't have the ability to meet all of the needs of those tests. But everybody needs to get tested if you feel symptomatic of anything relates to those symptoms people have laid out, and if you think you may have been exposed to someone who is COVID positive. So the symptoms are not unique in African Americans. You may have people who may have more of a persistent cough or may have more trouble breathing. Well, you would likely have more trouble breathing if you were a cigarette smoker for a long time, or if you have asthma because you lived in housing that was not standard or had substandard housing and didn't have good clean filters, or you live near air pollution plant of some sort. All of these things will give people asthma, which could make your symptom of having trouble to breathe to be much more at a level. But it doesn't necessarily mean that if you don't have that, then you don't have coronavirus. So there's no uniqueness to the symptoms that we can all say, if I got a cough, if I got a headache, if I got a fever, then must have corona. But it also doesn't mean if you have those three things, you don't. So my point is to monitor. If you start to feel bad, if you think you might have been exposed, then you need to get in touch with a provider. So there's, virtual urgent care that exists all over the state. You got Doctors Care doing, MUSC doing some, Prisma's doing some stuff. You got all kinds of providers who are allowing you a virtual platform in order to be able to get screened. And so if you don't have a virtual platform, then call your provider and they should have a phone way to work through their process. But again, these symptoms can be unique to every person because there isn't a lot of commonality at this point because the virus is still new. We're really just barely 6 months into understanding this virus. And then we might understand it from a China standpoint. We may understand it from a Italy standpoint or what's going on in Sweden. But remember, the population of the United States of America is very different than all of those places. Our diets are different than all of those places. Our communities are different. And our people are much more diverse than in all places. So if I'm an Asian 55 and I've been symptomatic because I grew up in Wuhan and lived in Wuhan my entire life, or I'm an Italian who grew up in the Mediterranean all my life, been eating a Mediterranean diet my entire life, that's going to be a whole lot different than somebody who grew up in South Carolina, who lived in South Carolina their entire life, and their diet and lifestyle is completely different. So these symptoms could play themselves out to be very different for our population in South Carolina, whether you be Black, white, old, or young. So you got to know what all of the symptoms are and be prepared to get yourself screened if you start to feel bad.
Right. And I want to say, for those of you who might be just joining us, I'm talking to Anton Gunn about some racial health disparities. And you mentioned testing. I do want to say, thanks to the leadership of our local delegation and MEOC, where you are, there is testing for those here in Columbia right now. They actually are doing testing today from 10 to 2, and then next week as well at Eau Claire High School. And you do not have to have symptoms. But so if you feel like you've been exposed, or you have that cough that he's talking about, a lot of us, I've even had a cough, and I tell people it's allergies, but make sure that if you have a persistent cough, if you have any of that, and you want to get tested, so that go get tested. But I do want to say, and this has been a big discussion, I know I've had this with Dr. Linda Bell a couple times. I don't want people to think, okay, I can get tested, that means I can go back to normal, because that test just says whether or not you have the virus now. It doesn't mean that you're not going to go out from that test and then interact with somebody or touch something and then get it. So don't be, if you get a test and it tells you you're negative, that doesn't mean I don't have to social distance, I don't have to wear my mask. You still have to be have precautions. Let me ask you this, because we've talked a lot about the virus, but again, there's that underlying health conditions and the racial health disparities that we have. A lot of folks really were, I think people understand that access to healthcare has always been a challenge. When the Obama administration came in, that was the number one goal, was healthcare, and to pass, Affordable Care Act, everybody affectionately calls Obamacare. Didn't get everything that you guys wanted, but it was a start. But can you kind of take us back to that? Because I think people don't really understand kind of the way legislation kind of comes about, and why was it so important for your administration to champion healthcare, the Affordable Care Act, and get something passed? And from now that it's been in place for a while, how do you see, how it's worked, and where do we still need to push to make sure that more people have access to quality health care?
Yeah, that's a great place to start. So, and this kind of goes back to my history before ever meeting Barack Obama. I started working on healthcare access in South Carolina in the mid 1990s, around 96. Okay. And one of the things that I learned after doing community work and talking to small business owners and talking to entrepreneurs and talking to low-income families in general is that people were very frustrated with the American healthcare system. Now, what do I mean frustrated? I mean, you had large numbers of people who were entrepreneurial, that they wanted to start their own business, okay? But they had a corporate job, and they had a spouse or a child that had special needs or some disability, or maybe even a chronic condition. And they really wanted to start their business, but they knew that if I quit my job and start my business, I'm gonna lose my health insurance coverage. And I can't buy an individual policy anywhere on the market. And if I do, I'm gonna buy a policy, a card in my pocket, but it ain't cover none of the stuff that I really needed to cover. So like if my wife gets pregnant, it ain't gonna be covered. If I have asthma, it's not gonna cover my asthmatic medication. So people were frustrated with that. They were also frustrated with how insurance companies, even if you have coverage, would deny paying for certain services because you quote unquote didn't disclose that in 1979 you spent the summer in Queensbridge Projects at your aunt's house and there's lead-based paint in those walls. So now that you got cancer, we're not covering your cancer treatment because you didn't tell us that 35 years ago. So these are the kind of things that insurance companies used to do to collect premiums from you, but not provide coverage for services. There were other challenges about hospitals that if you had health insurance coverage and you went to a out-of-network hospital because you were on vacation in Florida and got sick, they would charge you 20% higher costs because you weren't in their network. And they were discriminated between men and women. So, Tameika, we can be the same age, but your health insurance premium is going to be 20% higher than mine is just because I'm a man. And that makes no sense at all. So people were frustrated with that. And so when President Barack Obama got elected, even though we were in the middle of a recession and everything was going bad around us, he heard unequivocally the concerns, complaints, and the challenges about our healthcare system. And most importantly, 50 million Americans, 50 million people had no access to it. They were either locked out, priced out, or completely shut out of the health insurance marketplace. They couldn't get coverage for themselves or their kids. Your child graduates from high school at 18, goes to college, and before they graduate from college, you had to drop them from your health insurance coverage. And that made a lot of people scared for their young adult kids who they knew would be uninsured. So the point of the Affordable Care Act was to try to close some of these gaps, to provide coverage for millions of people, many of them in South Carolina, who wanted coverage but couldn't afford it, couldn't get it, didn't know if it was going to be good coverage, and wanted to make sure that if their families got sick, if they got sick, they had means to be able to get whole that was affordable for them, met their needs, and definitely fit into their budget. Okay? That was the ACA. We never intended it to be the end all because there's so much more we can do to improve healthcare. As you can see, that even if you have insurance coverage right now, you could still get the coronavirus and you could still die from it without life-saving treatment, without the right mechanism. So these are other things that insurance doesn't necessarily solve for. So our point was to try to raise the floor, if you will, of the number of people who had coverage. And the whole point was, how do we get more people covered? How do we make sure that people get what they need when they need it? And we have very little uninsured. In the states that implemented the Affordable Care Act, their insurance rates have dropped down to 2%. Uninsured rate dropped down to 2%. So 8% of the people in their state coverage. But a state like South Carolina, who didn't expand Medicaid, who didn't have a robust health insurance marketplace where the plans were strong and affordable, we have an environment where we still have about 10% of our population that is uninsured. Now, let me be clear. 10% is a lot better than the 24 or 25% that we used to have. Mm-hmm. But 10% is far too high, far too high.
Mm-hmm. And I think a lot of people don't get that because I know folks who will hear like, oh, South Carolina didn't expand Medicaid. They have no idea what that means. But then they want to say, well, I can't go to the doctor because it's too high, or I have to, I have to figure out whether or not I can pay for my prescriptions or feed my family. So there are so many things that our state is missing because it did not expand Medicaid. And as an elected official, and as a former elected official, and someone who has worked in government, this, that part of the frustration part of the disappointment sometimes is being able to make sure that people understand how to advocate for themselves, because I certainly can call, the governor's office and say, we need to expand Medicaid, but the governor's not going to listen to me. I'm a, Democratic elected official, and, I'm not in his party. I'm not, even though I vote for him, I'm one person. So, but if more people call their legislators, call the governor's office, we may see some change. One of the things that you talked about, how long you've been doing this work. When I first met you, you were working for South Carolina Fair Share. And I remember, I don't know if you remember this, I remember coming to a training that you were doing for the community about how to advocate, because you were a lobbyist and you were up there, but people, all folks have lobbyists up at the State House all the time, and, they have their friends, but when the people who live in their district come up there, they're going to listen a little bit more than they will Anton Gunn, the lobbyist for Fair Share, or Tameika, Devine, the city council person. But I don't know if people understand how effective that can be in talking to their legislators, and then making sure that they're educated enough about what does expanding Medicaid mean, or what does access to healthcare mean, or why does it, for local level, why is it important to my health if I do have sidewalks or not? So can you tell us a little bit, like, for the average person who's watching this? Yeah. And we got some folks watching now, and I know a lot of folks are going to watch the replay. And those of you who watch the replay, tell me you're here watching the replay. And if you have a question, I'm gonna make sure I get it to Anton so we can get you the answer. But what are some of the things that you would like to see as someone who has worked for years in healthcare and has been an elected official, where do you think we can actually affect change by citizens empowering themselves and educating themselves and then advocating for themselves to have change in healthcare across the board in South Carolina?
Yeah, so and I think it's a great. First thing that I want people to understand is being a good citizen is more than just voting. A lot of people vote, and you should vote. And I want every person to understand that you should vote. But I want you to understand that voting is the minimum that you should be doing, because elections come every 2 years or every 4 years, but legislation and policy pass every year, sometimes every week and every month. And so if you want to be a good citizen, the first thing you can do is to vote for your candidate, is to get up to speed on what their agenda is and make sure that they understand what your agenda is. What I found to be most effective when I was working doing grassroots community organizing and being a grassroots lobbyist, if you will, is the power that individual citizens have when they show up and talk to their lawmaker. So members of the House and the Senate, they run for office every 2 years, and they love to talk to their constituents. And they really love the constituents who are informed and educated about the policy issues. So don't just go running there willy-nilly and say, hey, I want free ice cream for everybody that lives in the city. Yeah, ice cream free for everybody sounds good, but that ain't important to a lawmaker, because a lawmaker is trying to figure out, how do I make a better difference in people's lives? And they have their own ideas about what that looks like. They might say parks are the best thing we can do to make sure that we improve people's lives. Or they might say it'd be better if we improve our public schools to improve people's lives. They have their own ideation around everything. But your real life experience is what they don't have enough of. That they don't know the challenges of being a single mom and trying to raise 3 children, pay for daycare, and only work for $11 an hour. May not understand that. But you telling your personal story, sharing a real experience with them, and then after you share your story, say, this is what I want you to do. I want you to increase 4-year-old kindergarten, because I got twins that are 4, and if they could go to 4-year-old kindergarten, then I would only have to worry about one child in child care, and in that way, that would save me a whole bunch of money. So don't just tell them your story, tell them what you want them to do. And in order for you to tell them what you want to do, you have to understand the issue, you got to understand the challenges. And so ask your legislator, your city council member, your mayor, governor, to send you an update of what are the issues before the state or before that body. What are they working on? You want to know what's going on and what their opinion is about those things. And I'm telling you, we will get a much better democracy when we have more and more people participating in that democracy beyond voting. Voting is the minimum of what you should do, but you should advocate, you should engage, you should meet with your lawmaker, and not running for re-election. We all get to hear from our elected officials when they're running for re-election, but talk to them after the election, to them when they ain't running for re-election, and learn what's going on. But the challenge is, the reason why people get sideways and they don't support the policies that the most of the people poll that are important is because they don't hear from you enough. They only hear from you every 4 years. The same way we as citizens complain about, well, I don't see my elected official but every 4 years when they running for re-election. Well, it's both of y'all fault. It's the elected official fault for not showing up every 4 years, but it's your fault for every 4 years waiting to ask for something, when you should ask for something all the time. The more active we are as citizens, the better democracy we get, the better we're able to address things like the COVID-19 crisis. So get past this, and we've dealt with the coronavirus in full. Don't forget about public health, because the coronavirus is new. but SARS was new in 2010. The influenza H1N1 was new in 2009. So we're going to face some stuff like this again. And when we do, we want to make sure our elected officials are prepared to respond, that they know how to respond, and most importantly, they respond early and not respond late. And the only way that happens if we fully understand what has happened, and each and every one of you to focus on that. And that's how we eliminate disparities. We eliminate the disparities when the people who are most affected by those disparities spend more time talking to their leaders about those disparities. So you got to engage, and would actually lower the percentage of disparities in the United States of America. We would lower negative health outcomes for people of color if we have more active and engaged citizens around all kinds of issues, not just coverage, but everything, and sidewalks in our community so you can get out and exercise more, like having more green space and parks for our kids to play, because that reduces obesity rates. Everything is connected. And as a citizen, you got to understand how all of these things are connected, because when you do, then you become a much better advocate for what you want.
Now, I know you don't have a crystal ball, but the fact that the health disparities are getting a lot of conversation in relation to COVID-19, do you see any changes happening that will really meaningfully affect or address health disparities as it relates to communities of color?
Yeah, listen, I just had this conversation about an hour and a half ago with a physician. He's a trusted physician in the community in Charleston, very well respected, trains a lot of future physicians. And he was saying that he believes that there's going to be a fundamental shift because of COVID-19. He says he thinks that because the disparities are so pronounced in what's happening. I mean, like literally, Black folks make up about 37% of American population, but right now we're hovering around 75% of the people who tested positive for the coronavirus. And if you look at the patients who are hospitalized and on ventilators, like 81% of the patients on ventilators. And the data is showing that if you go on a ventilator, chances are you may not make it, a high chance, like 80% chance that you won't make it. So if 80+% of the people on ventilators are Black and 80% of those don't make it, we know who's dying from the novel coronavirus. And so this clinician feels that this is going to put so much under the microscope in America that we're really going to see how bad disparities are, that we're going to be forced to do something. But he said in the same breath, he says, I thought after what I saw in Katrina, that was going to force us to do something different when it came to the disparities around housing, and I was wrong then. And he said, I'm praying that I'm not wrong. So my crystal ball tells me that what we'll see is not a focus on disparities. And I wish if I was in charge, I said this jokingly, but I'm saying it more seriously now than ever. If I was in charge of America's healthcare system, I believe I could reduce and eliminate disparities in 15 years if I was in charge. Because I got enough expertise and experience, and I know enough people who are much smarter than me on how we can close these gaps. But I don't think that that'll happen realistically. So here's what will happen realistically. I feel like that there will be a new renewed focus on public health. And when I say public health, like in South Carolina, DHEC agency in the state, DHEC could use a lot more staff, a lot more resources, and a lot more framework around how they can improve the community's health in general. How do we make sure that, again, sidewalks and bike trails and basketball courts and soccer fields, and that we're growing more farms, and we got more community farms, and there's fresh fruits and vegetables for people to have. How do we do all of those things that we know were good that contributes to our health? DHEC will get a lot more support in leading those kind of efforts in our state and other states around the country. And that in general is going to help all of us overall. So it will African Americans, it will help the LGBTQ community, it will help folks who suffer from lots of disparities. There's going to be some more focus on mental health because of this, because we're all probably at wit's end, sitting in the house, trapped in the house for 6 weeks, and about to pull our hair out or choke our family member out because we just frustrated. And that's not a good place for any of us to be. And so there's going to be some focus around mental health that will also have some disproportionate impact to improve outcomes for people of color. But really, if we get back to the root of the problem, the root of the problem is that your health care is only about 10% of what might be right with you or wrong with you. Your actual health is only about 10%. 90% is everything else. How much education do you have? Because the higher your education, the better your health outcomes. This is all statistically correlated. What kind of community do you live in? A lot of people don't realize that the number one factor to determine your life expectancy is your zip code. That if you live in 29229 or 29223, you have a higher life expectancy than people who live in 29203 or 29209 because of the income differences in those communities. The percentage of people with degrees, master's degrees, and terminal degrees in those communities. So the social determinant is your education level, your zip code. Do you live in quality housing or do you live in substandard housing? Do you have access to a grocery store in your community? Do you have a job that pays enough of a wage that you can go to the doctor and pay a copay, or to be able to get a shot, or to be able to get treatment for any disease that you have? So the social determinants of health is 90% of what creates health disparities. It has very little to do with your health, but most to do with all those things that contribute to you being sick. I mean, the number of women in rural communities in South Carolina that don't have all their prenatals done before they deliver their baby. Why don't they have that? Well, we have 4 counties in South Carolina that don't even have an OBGYN in the county. So you get pregnant in your county, there's no OBGYN in the county. So if you don't go to your prenatal visit, how do you get your prenatal meds to make sure that you get enough folic acid, that you get enough calcium, and all these things for you to have a baby that is at least 6 pounds? Because under 6 pounds is considered a low birth weight baby, which begins the process of when health disparities start. So all of these things are connected to what happens in your community. So my crystal ball says, overall, we'll see more focus on public health. I want to tell everybody this. I know this is a health disparities conversation, but I want you to know, some of you that have lost your job is not coming back. It's not coming back because businesses are changing right before our very eyes because of this coronavirus. I just read a study that says that literally remote work might grow 30% because of the coronavirus. That some employers are going to say, you know what, Tameika, because you're doing so good working from home, I don't want you to come back to the office. As a matter of fact, we're going to sell half of our office space and rent it out to somebody else, and we're going to downsize. So I, as a business owner, can pay less rent, but now you're going to have to work from home more. And so when you work from home more, how do you balance that when you got a 2-year-old? How do you balance that when you got 2 other kids? How do you balance that when your house is not really built for you to work from home? So these things are going to change. So some jobs are not going to come. Some jobs are going to evolve. Our public health infrastructure is going to change. But I think a lot more things have the potential to change because we just see how fragile our economy is. That some small businesses, they went 2 weeks without customers and they had to close their doors forever. Mm-hmm. Some other small businesses could make it 30 days, but they had to close their doors forever. And some of those businesses will not be coming back. So you might, if you worked there yesterdays, you know it ain't coming back. So these are the things that are going to be impactful, and we have to be vigilant because the people who tend to be affected by these kind of major disruptions are people of color, African Americans, Latinos, young people, all kinds of demographics who tend to be at the lower end of the work spectrum when it comes to a business. Not a lot of us in the C-suite, not a lot of us at the senior VP, but many of us are on the front lines, the cashiers, the customer service representative, the environmental service workers, even a frontline manager can be disrupted by all of this. And so that's what I think is our world would be different when we come back. And I did this on a Facebook Live called The 7 Things That You Need to Know in the Middle of This Crisis. And so I try to do something every week to give people something to think about, to prepare themselves. Leader, regardless of your role, whether you have a job or not, you're a leader. You might just lead yourself. You may lead your family. You may lead your community, or you may lead in business. But everybody's a leader, and every leader needs to know what's happening so they can prepare and respond to it.
Wow. That is definitely a topic we got to get to at another time, because when you were talking, it just reminded me of when Andrew Yang was running for president. He kept talking about how many jobs were going to go away. And he was talking next couple of years. But yeah, the reality is this has caused a lot of people to do things, even me. I mean, I mentioned to you before we came on the live stream, I did the majority of my work at home right now. And I had to come in the office today because I had to meet with clients, but everything else, my staff person is working from home, but she's very efficient at home. So that's going to affect a lot. We're running short on time. So I wanted to hit 2 other things real quickly. Or really one major, it's kind of come together, but I love your book. And if I did this from home, I actually, next to my computer at home, I had your book and I was going to hold it up. So I see it behind you, but for everybody, you have a book called Presidential Principles. And in your book, you share lessons that you believe the best leaders exemplify. But one of the things that you talk about in your book is you talk about that the best leaders work today for tomorrow's impact. And so before we close, I want you to really address that as a leadership criteria, really, for all of us, because I think a lot of people don't realize how, yes, today, things that happen today and things we do today will impact the future. And, you know, whether or not it's planned or not, coronavirus wasn't planned or not, but clearly what's happening right now will affect the future of work, the future of healthcare, et cetera. But what can we as citizens, as people who have a vote, but also have, more importantly, have a voice, what should we be doing today to impact the future as it relates to healthcare, to really bring about those better outcomes, specifically for communities of color, but for everybody, because we know if everyone is healthy, then our communities are healthier. So what should we be doing today, right now, to make sure that we are affecting better outcomes as it relates to healthcare?
Yes, that's a great place to kind of close out on. And I had a mentor tell me, he says, Anton, when I was doing community organizing, trying to improve outcomes for poor people and trying to change the landscape for poor people, and he said to me, Anton, one of the first ways you can help poor people is to not be one of them. And that was his admonition to me: get your own house in order before you try to help someone else. The same, you get on a plane, the flight that tells you to do what? Put your mask on first before you try to help somebody else put their mask on. Because you can't save other people if you don't save yourself. So my point to everyone is, if you want to be a leader, like in my book, The Presidential Principles, I talk about the principles that make you a great leader, and I frame it up into 3 ways. Number 1, service, empowerment, and the third piece is legacy. Legacy is really about working today for tomorrow's impact. If you want to be a leader that makes a difference, that is not just successful, but you're significant in the lives of other people, the first thing you got to do is got to take care of your health. Because if you want to mitigate any kind of health disparity, if you want to be here and make sure the novel coronavirus doesn't take you out of here the way it's taken a lot of other people out of here, you got to focus on your own health. And that's the hardest thing to do. The hardest thing to do is to get right yourself when you try and tell everybody else to get right. And I will tell you, I'm gonna own that completely. I still look like a college football player, even though I haven't played college football in about 26 years. Okay, there's no reason for me to still be big like a football player. There's no reason for it at all. I'm not going to block anybody or tackle anybody. So at 273 pounds, I'm still way too big. I'm the same weight that I was when I was playing college football, but I haven't played in 26 years. So there's no reason for me to be this weight. But guess what? I'm actually 15 pounds less today than I was before the coronavirus started. Because since I've been home, I've been much more mindful and focused about what I eat and my exercise. And yes, I can't go to work and travel and do all the things that I was doing, but I can walk around my neighborhood. And I walk 5 miles a day since the coronavirus has started. And just walking 5 miles a day, I've lost 15 pounds.
Wow.
I've cut back on sugary foods and drinks. I've been eating better because I don't want the coronavirus at all. That's why I'm staying in the house. But if I do get it, it's not going to take me out of here the same way it's taking other people out of here. So I can't build a legacy if I'm not here. I can't have an impact tomorrow if I'm not here to have an impact today. So my first point to everybody is the first thing you do is you got to work on yourself, improve health outcomes. Secondly, do something to help someone else, serve someone else. So right now, I've been working with my fraternity brothers to deliver meals for our sick and sheltered African American seniors here in Charleston. They literally may not have fresh fruits and vegetables. They don't have a Costco card, and they can't go buy 30 days worth of groceries at Costco or BJ's or Sam's. They can't afford to do that. They buy meals week to week. And because they're already more susceptible to have underlying conditions, coronavirus. So what we're doing is to make sure that they get healthy meals. So all of us can do both of those things. We can all work on ourselves, and we can all do something to serve somebody else. But the best thing you can do is to be educated on disparities, be educated on health disparities, and become an advocate, a long-term, someone who will not be deterred at all of advocating that our policies in South Carolina, in every city you live in, that they be an advocate for proven health outcomes for those folks that are underserved. Because if you help the least of these, then all of us will buy that process. That's what I tell people to do is if you want to work today for tomorrow's impact, find yourself a way to improve yourself and find a way to help others and continue to advocate for those who are left out.
That is wonderful. And that is a great way to end. I will say one thing that people can also do is taking what Anton just said. We're all home. Get on the phone, send a letter, send an email to your elected officials, because this is really something that we should all be addressing. Because there's something that's got to change. There's something that's got to change. You talked about DHEC and other things. I remember when I was first elected, DHEC actually had a pot of money that would help local governments build sidewalks. That money is gone, and it's like every time I have a neighborhood, an older neighborhood, like sidewalks, and it's expensive to put sidewalks, and the city doesn't always have money, and that pot dried up because they don't fund that kind of thing anymore, because people don't think about how important that is. But if people want to get out and be healthy and walk, if you're not going to walk in your neighborhood if it doesn't have a sidewalk. So that's something we can all be doing right now, and definitely taking a page from your book. I'm not sure if I'm going to be walking 5 miles a day, but I need to get out there. I got my bike, and the kids and I have been riding bikes, and Jamie, and so I got to get out there and like you said, practice what I'm preaching. So, Anton.
That's right. I mean, listen, the bike is great. You can do the bike. I got a bike too. It's hanging up in my garage. I got to pump my tires up. And I had to get a little thing so I could put my phone on there and ride and listen to the music as well. But we all can do something. The key is just do something. No matter what it is, just do something.
Yeah, I need to lay off the Oreos. That was my thing when I was so stressed at the very beginning of this thing. I had not bought Oreos in years. I was buying Oreos and I was eating them, and I had to eat a whole pack of Oreos. So that was my stress eating. But I stopped buying Oreos, so at least I've done that.
Yeah. Yeah.
So
That's good. Stay away from Oreos.
Before we close out, everybody, I have on here your Facebook, so everybody can follow you on Facebook. But I want other ways that people can get in touch with you, because as we talked about, number one, you're a wealth of knowledge, but number two, your presentations on leadership are amazing, and so people need to follow you and see you more. So share with everybody how they can get in touch with you and how they can follow and see what you're doing.
Yes. So my home for all things Anton Gunn is my website, which is antongunn.com, ANTONGUNN.com. I'm on Instagram, on Facebook, I'm on Twitter, and you can find me at Anton J. Gunn at all those. And I do most of my writing and my teaching and training on the LinkedIn platform. That's where I spend a lot of my time. And so you can find me at Anton J. Gunn on LinkedIn as well. And I love to engage in dialogue. I'm always posting something every day. If you're and go to my business Facebook page, which is Anton J. Gunn there. Because if you try to friend me on my personal page on Facebook, I'm maxed out at 5,000, so I can't add anybody else. So go to @Anton J. Gunn, @Anton J. Gunn, and I'd be happy to dialogue with all of you. And I got a lot more content and teaching and training for anybody who's trying to grow themselves as a leader and want to build a world-class culture for the teams that they work with and those that they support. So that's where you can find me.
Great. And I put your website and name in the comments, and I'm gonna go back and do a link to his business page and LinkedIn page for all of you guys. So like I said, those of you who were here, got a lot of great information. Go back if you just jumped in, watch the replay, share this, because this is information that we all need to have. Whether you're whether you are a minority, African American, or Latino community, or you're in the Caucasian community, we all need to be involved in affecting change for better health outcomes. So share this widely so people can hear what Anton had to say. And then I wanted to thank you guys for joining us again. Next week is Teacher Appreciation Week. So instead of just doing one community conversation next week, I'm going to be here every day. I'm going to talk to representatives from SC for Ed. I'm going to talk to representatives who are in childcare. I want to celebrate our teachers, but also bring you guys some good information. So continue to watch, and I'll have some information on that. But until next week, thank you for joining me for another community conversation with Councilwoman Tameika Isaac Devine. You guys stay safe, stay well, stay home, stay inside, wear your mask if you got to go out, but continue to stay well and be blessed. So until next time, I'm Tameika. Thank you again, Anton, and see you guys later.